There we go. Hey everyone. So today I whipped out my whiteboard because we've got a very important topic to go over, and that is HCM. And hopefully you can see me okay. So HCM and what HCM is and what HCM means to the hairless cat breeds like the Sphynx and Bambino, and basically any of the variation of hairless cats that come from the Sphynx genetics. So HCM is an acronym standing for hypertrophic cardiomyopathy. That's an O. So you can see why we just call it HCM, because hypertrophic cardiomyopathy is a pretty big mouthful of a word. But this condition can affect any breed of cats. In fact, it can affect any species. Humans can get HCM even, albeit pretty rare. But any cat breed can contract HCM. It just tends to be in a higher prevalence in the hairless breeds for, pretty much an unknown cause. There's a few cat breeds that HCM is more prevalent in, and it also includes cats like the Maine Coon cat, and the Ragdoll cat, and the Persian cat, and the Sphynx cat. So, typically you're going to have higher incident rates in your purebred cats like the Sphynx cat, kind of your typical domestic short-haired cat is going to have less of a prevalence rate of acquiring the condition. But that being said, because these cats do have such a high prevalence to acquire HCM, it's very important that you, number one, understand what HCM is, and number two, understand what it is you need to do about it. So first, let's talk about what HCM actually is. So I'm going to try to draw and laugh at myself because I'm an awful artist. But I'm drawing a heart, so we're gonna do something like this, and this is already a bad drawing, but this is like a vein bringing the blood into the heart, and this is an artery bringing blood out of the heart, so we all know that's kind of how our heart works. And the blood comes in, and you have different chambers of your heart, like this. And these chambers are where the blood flows when it comes into the heart and goes over to the other side, gets oxygenated, and brings oxygenated blood out of the heart. So this would be a very bad example of a healthy heart. This probably looks really diseased actually, but no, this would be an example of a healthy heart with your ventricles and your chambers. And what happens in HCM is this word right here. Hyper means more, and trophic means thickening. So what that means is what can happen in an HCM diseased heart is these walls of the heart start to thicken. And this is the hypertrophic nature of the disease. And so over time, these heart walls thickening reduces the flow of the blood in and out of the heart, which increases the workload on the heart and how hard the heart has to work, which then leads to the cardiomyopathy part of the word, which basically, myopathy means muscle disease, so the heart just gets stressed, gets overworked, gets weaker, and eventually can lead to CHF or congestive heart failure. So that's the process of what the disease looks like. So now what you need to do about it. So what you need to do first off is, if you're adopting a hairless cat especially, you want to make sure that you're adopting your cat from a cattery where the breeders are scanning the adult cats for this. We call it an HCM scan. Now, an HCM scan, sorry for the big mess, is actually no different than an echocardiogram. I really need handwriting lessons, apparently. But many of you might have heard about an echocardiogram or even had one yourself, and it's when basically your doctor just does an ultrasound, like they would do, for a pregnant woman, but an ultrasound on your heart, and that way they can see very well all the chambers of your heart, see the blood flow, watch everything. So when we say HCM scan, that's what an HCM scan is it's technically an echocardiogram. It's an ultrasound scan of the cat's heart. So breeders should be having this done on all of their adult breeding cats before breeding and during their lifespan of breeding in the cattery, because they want to be looking at the adult cats' hearts and making sure they're free of this condition before the cats are being bred. And the reason we do it on the adult cats and not the kittens is because this condition typically doesn't develop until about 1 year of age. So you want to make sure, number one, that adult cats are scanned. And then the reason, to back it up a little bit, the reason why we need to do these scans of the heart, and the big thing, probably the biggest thing that everybody needs to understand with HCM is it can be a completely silent disease, especially in cats. Cats are very good at hiding illness and hiding symptoms. When they're sick, a lot of times we won't even know until it's very, very progressed in illness. So oftentimes HCM can be there and be developing and be quite severe before we even notice any symptoms. There may be a heart arrhythmia that can be heard. Your veterinarian with a stethoscope listening to your cat's heart might be able to hear an arrhythmia, but sometimes it's there, sometimes it's not. But once the cat gets to a level of disease where there would be an outward symptom, like trouble breathing or lethargy, usually the disease would be pretty far advanced to the point where there's not going to be much that can be done. But the good thing is that once you're aware of this and you're taking your cat for HCM scans and checkups, this can be diagnosed and treated, and if they have the condition, it can be treated very easily, very affordably, and prolong their life greatly. So that's the reason why we need to do these echocardiograms or these HCM scans, is because it can be a silent condition. So first off, you're adopting from a breeder where their adult cats are scanned, and please make sure you're asking the breeder to actually see the HCM scans. A lot of breeders, hopefully most every breeder breeding these cats now, know that this is a problem and should be done. But some breeders, if they maybe are trying to get by and save $1 here or there, because these scans are very, very expensive, we've unfortunately been alerted to many, many cases where breeders are, kind of being shady and saying they're scanning their cats and they're actually not, or even trying to use other catteries' HCM scans. So, if I were to be adopting a kitten from, King Tut Dad, let's say, and Molly Mom, I'm going to be asking that breeder to show me and email me or send me, proof of those two cats' HCM scans so that I can see it myself and verify that it's actually been done, because these scans can cost up to $500 or sometimes more per scan. So it's a big expense to breeders, and that's one reason why these cats tend to be such high adoption fees. To do it correctly is to do things right and get these scans done. So that's number 2, is see the HCM scans yourself. Number 3, so now you get your new little bundle of joy, and what's the next step? When do you need to scan your cat? So most cats are not going to develop this condition, if they're going to have it, until at least a year old. And a year old is really pretty minimum. I've very, very rarely through the years ever heard of cases where HCM was acquired before a year old or even right at year old. It's typically more not until the age of about 2 years, and in fact a lot of cardiologists, veterinary cardiologist specialists, don't recommend even scanning until the cats are 2 years. So we always tell everybody sometime between that first and second birthday, somewhere in the middle would be good, really. A year and a half and no further than 2 years is to get the first HCM scan done. So first scan by 2 years. And now HCM is considered to be a genetic condition. So that being said, this is something that we're more looking for in the early years of a cat's life, between the ages of about 1 to 8 years old. It can happen after 8 years old, but typically if it's going to happen after 8 years old, it's going to be more from like a developmental condition or possibly from other factors that just come with aging. But doing these scans specifically, we're looking for a more serious, more fast progressing form of the condition that is genetic, and that's going to be acquired somewhere between usually 1 and 6 years of age. So what we recommend to everybody is to scan your cats at least by 2 years, and then at least every 2 years after that. If their first scan is good at 2 years old, you can wait until 4 years and then again at 6 years. If your cardiologist recommends that, sometimes they're going to recommend every year, so it just depends on your cat and your cardiologist and the particular situation. But usually we're going to scan at 2 years, 4 and 6 years, and then it's up to you from there, depending on what you how proactive you want to be with this and what your cardiologist may recommend. Because then again, even after 6 years old, this condition could develop, and again, it's usually a silent condition, so at any stage in the cat's life, the sooner it's diagnosed, the better chances of treatment. So step 4 is where to scan, and this is a big question a lot of people have. I'm slaughtering this board on me, sorry. Penmanship was never my strong suit. So a lot of people come and ask me where to get their heart scans done, and a great place to look, a great resource, is a website that's been developed called hairlesshearts.org, and it's a nonprofit site that's been set up, and it helps you locate what's called HCM clinics in your area of the country. And so you can start there and look and see if there's an HCM clinic in your area. Now what a HCM clinic is, what that means is basically it would be a place where a veterinary cardiologist agrees to be at a veterinary treatment center on a certain day, usually one day every month, and then the word's out, and a lot of people come to that HCM clinic all on that one day, and they schedule maybe 15 to 20 heart scans in that one day. So because of that, they can reduce the cost of the rates, and usually you're going to pay probably about a quarter of the cost that you would otherwise. So I will write that on here. Hairless hairlesshearts.org. And then if you get onto hairlesshearts.org and there's no clinics near you, what you'll need to do then is contact your veterinarian and tell them what you need done and have them recommend where you could go. A lot of times there are specialty animal hospitals, typically at like an emergency animal hospital clinic in your area, and the emergency clinics oftentimes double as specialty clinics where they have specialists like special dermatologists and ophthalmologists and cardiologists that will come to the clinic again on certain days of the week or of the month to do certain procedures, so you can get an HCM scan scheduled through them that way as well. So that's where you would scan. And then lastly is what if your cat has HCM? And you know, this is another question that comes about to me if someone unfortunately falls into this category where they get their cat's heart scanned and it shows that they do have HCM, and you know, obviously it's a very scary time and a very stressful time to know that your cat has acquired this condition, and people generally come to me you know, very anxious and worried about what's going to happen. So number one, you're going to follow whatever advice your cardiologist recommends for you to do. Typically what's going to happen is the cardiologist is going to recommend that you bring your cat back again in 6 months to have the HCM scan again, because they're wanting to monitor the progression of the disease and see how fast or slow this thickening may happen. And so your cat may be diagnosed with HCM, but a very mild form where the walls are just a very little amount thickened, and the cardiologist may just say, I just want to see them again in 6 months. We're not going to do any medication right now. Follow up, so you would do that. And then in 6 months' time, it might be only progressed not at all or a tiny little bit, and they're going to say, okay, it looks okay, let's check again in a year. You know, that's a good case scenario. And then, you know, it just depends on the situation and the individual cat. There may be a case where it's first seen and it's already pretty progressive, and the cardiologist is going to want to start medical intervention right then. And typically what that's going to be is some medications that will, number one, slow the heartbeat, so that puts less strain and work on the heart, so that you're not going to get to a congestive heart failure stage as quickly, because the slower the heart has to work, the longer it's going to do its job well. And then the other medications typically are going to be blood thinners, medications in the blood thinning class, and what that's going to do is it's going to help prevent blood clots somewhere in the body due to the condition, because oftentimes with the overworked heart and just the inefficiency of moving the blood through the heart into the body, blood clots is something that's actually one of the leading causes of death for cats with HCM, especially if it hasn't been diagnosed, because they're not on the medicine to prevent that. So those medications, though, are very affordable, thankfully, very usually easy to dispense to your cat. A lot of people can just put them in a little treat, like the pill pocket treats, and their cats will just eat it up, and usually it's usually just once, at most twice a day. So, you know, I try to alleviate people's worries a bit and let them know that, you know, just because your cat got an HCM diagnosis, it's not, you know, necessarily a huge crisis. You know, it can be managed, and the cats can still live potentially a long, very normal life on the right medication. I have known cats to live 12 years after an HCM diagnosis because they were scanned early. The one I'm thinking of was scanned at 1.5 years old and lived that long because it got on the preventive treatment early enough. So that's the huge thing that we cannot tell people enough is, realize the importance, realize the prevalence of the condition in the breed, realize the importance of getting the scans, and get it done. Just get it done. Do whatever you gotta do, make it happen, because I can't tell you how many times people have come to me, from cats that, not to say we've never had HCM in our cattery, because we have. Every cattery that's been along any number of years has, but unfortunately it tends to be from other catteries where maybe they really weren't educated on HCM. It wasn't even in their contract, like contracts from Little News Cattery from our cats. You are contractually obligated to do the HCM scan, so we make sure you're aware of this. But I can't tell you how many times people have come to me, and it's just heartbreaking because they didn't know, and the cat just dropped dead on them, literally, of HCM because it wasn't checked for, or by the time they checked, the cat was having symptoms and the condition was so far advanced, there wasn't much that could be done. So, being aware and the scanning and the early detection and the early diagnosis is just key. Your cat can have HCM and still live a really good, healthy, non-painful, symptom-free life for a long time. So that's why I wanted to make sure I took the extra time today too with this video and try to be very clear, besides my horrible handwriting, but be very clear on what HCM really is, what it all entails, and what you as a responsible kitty owner and adopter need to know and need to do to keep your baby safe. So hopefully I answered all the questions, and if anybody has any more questions, just post below. And yeah, let's get those HCM scans done and keep our baby safe. All right. Bye guys.